So who can benefit from schema therapy? Well, I'm a little bit biased because I've seen schema therapy help a lot of people, myself included and many of my colleagues. But when we look at schema therapy, as you most likely know, it was developed by Jeffrey Young as an extension to cognitive therapy, cognitive theory, or CBT, cognitive behaviour therapy. Because that therapy only really dealt with dealing with one side of the person, their cognitions. But as we know, most problems are a lot more complicated than that. We are a lot more complicated than that. So originally, schema therapy was developed to help people with what's called characterological problems, problems with personality. Long-standing, pretty entrenched personality difficulties that CBT just didn't really seem to help at all, because it didn't address a number of other levels that we know that are so important. The relational level, the emotional level. There are many other components that a schema therapy brings in, as you know. So originally developed for treatment for personality disorders, including things like narcissism, narcissistic personality disorder, borderline personality disorder in particular, which, is really just a label that describes someone who is experiencing disorders in early attachment or forms of kind of relational trauma, developing in childhood because certain core needs were unmet, particularly the need for validation, the emotional validation, where someone is really seen for who they are as a unique person and they're heard and they're appreciated. So putting that aside, because borderline personality disorder is a complex disorder, it has many components, but that was one of the things that schema therapy was developed to address, to treat. But really, there's so many people and so much more of a broader application where schema therapy can be applied. Because we all have schemas, we all have modes, and we all probably have problems that are underpinned by a schema. Your workaholic who can't leave the office, who shows excruciating attention to detail, who can't delegate, has an unrelenting standard schema. I mean, they may have other schemas, but that might be the schema driving those behaviours. So we all have schemas that are likely underpinning problems that pop up in our lives. We may not have problems through every domain of our life. Maybe it's just in interpersonal relationships. Maybe it's about, problems in our relationship or marriage. Maybe it's only about problems at work or when we meet certain types of people. But one thing's for sure, we all have schemas, and we most likely all have difficulties which are underpinned by a schema. But in a broader sense, schema therapy is great to treat any type of persistent long-term pattern which is making you feel really stuck in life. Or persistent emotional disorders, for example, depression, right? Chronic depression, recurrent depression, depression that is difficult to treat. Schema therapy is great for that. I have met many people who have responded well to schema therapy when they haven't responded well to a host of other interventions, both psychological and medical. They have responded well to schema therapy because, as we know, schema therapy looks at the developmental origins, the beginnings of these deeper core psychological vulnerabilities. So the schema therapist is interested in finding out what's driving the depression, what's maintaining the depression from a psychological or schema point of view. What are the things in your relational world that are triggering and maintaining the depression? Are you in schema-driven relationships? Are you not getting core needs met in a relationship? Are you constantly getting triggered in a relationship? Are are you a self-sacrificer? And at work you can never set limits, so you're actually exhausted all the time and you're really self-depriving. So there may be many facets that psychologically that may be driving your depression. So don't give up if you have chronic or recurrent depression. And if you've been given a label such as treatment-resistant depression, don't take that as gospel. Get other opinions. Often treatment-resistant depression is, I would say, a sloppy and lazy label for not finding the right treatment. So don't give up, because Schema Therapy can help. It may not be the whole answer, or it may be. So it's worth pursuing that and having a read about Schema Therapy if you do suffer from chronic depression, because often that can be extraordinarily helpful to you. Other types of patterns. So you might be someone who just can't say no. You might be driven by guilt all the time. You're constantly putting your hand up to volunteer for things, or when people ask you a favour, you can't set limits or you can't say no because you do feel very guilty. So you might have problems with sort of limit setting and poor boundaries. That may be another pattern in your life. Another pattern may be the that was a self-sacrificing pattern. There's other examples of someone who also needs a lot of approval. So all of these kind of other directed schemas, the self-sacrifice, the subjugation, where you're basically driven by a lot of fear. You feel like you're being controlled and you're expecting to be kind of like screwed over by people. You're expecting the worst. Maybe you were raised by a very narcissistic parent and you were dominated and controlled, and you were never allowed freedom to express yourself or your true needs or emotions, and hence you were very subjugated, and so maybe you have a strong subjugation schema. So all those other directed schemas, those three, are very, very common, for example, in recurrent and chronic depression. Or maybe you're someone who is a real perfectionist and it's getting you down, because you're always at the mercy of the world and the environment. That's a big one. Strong, unrelenting standards. Or maybe you're always in that perfectionistic over-controller mode where you have to keep your hands on all the controls. You're kind of riddled with anxiety and you don't have a lot of positive affect, right? You feel like you need to be in control all the time, otherwise something bad will happen, or otherwise you won't feel, you'll get in touch with those feelings of inadequacy or that you're not good enough. So there are so many different psychological patterns. And I'll tell you one thing, that if you do suffer from a recurrent psychological or emotional disorder, like chronic anxiety, like chronic depression, or if you do have those difficult aspects to your personality that sometimes pop up, by all means, please don't settle for a band-aid approach. This is not about treating the symptoms. This is not about taking an antidepressant only. I mean, don't get me wrong, I'm all for antidepressants when they're necessary, and often they are very necessary and they can be very helpful. Certainly, they've most likely been very life-saving to many, God knows how many people since their invention. But they're not enough on their own. Take my word for it. They're not enough on their own, because they don't change those deeper structures in the brain. They don't change your behaviours. They don't change the way you view the world on a longer term basis. They do nothing to correct what happened to you in earlier life. So if you are suffering from chronicity, chronic mental health problems that I've mentioned, those sorts of things, trauma, if you have some PTSD but you have a background trauma in your childhood that's been unresolved, if you've got issues of personality, if you find it hard to relate to people, if you seem to always attract the wrong kind of partner, if you can't say no, if you feel like you're exhausted because you have to prove yourself, if you are constantly attracting narcissists in your life, if you have a pattern where you're always feeling bullied, if you're using substances to self-soothe or to escape reality, if you're self-harming for the same reasons or for a host of other complex reasons, then Schema Therapy is really likely to help you. So have a read about it. Google the self-help books on Schema Therapy. Have a look at what they are. On my website there is a resource page that lists some really good, useful books. Have a look at the books first. If you see yourself in those books, then perhaps seek out some Schema Therapy, and good luck with it.